Hey guys, welcome to my live. I'm going to close the door. 1 second. All right. So, welcome back to Monday nights, 7 p.m. Going live with me, Dr. Jarod. I'm a holistic doctor. I work with patients in person and virtually all over the country, some in Europe, but my practice is in Southwest Florida. So, every Sunday, I put a Q&A question submission box on my Instagram. So, if you don't follow me there, go to @Dr. Jarod Ward and follow me at the Instagram. And then I'll take your questions, and then we've got people outside looking for a kitten, so don't mind them. There was a little stray kitten in the back, so they're trying to find him. Good luck. I saw him run by the other day, so I hope he's okay. Anyways, all that to say, thank you for joining, and every Monday, 7 p.m. Sundays, submit your questions on my Instagram, so you don't follow me there, @Dr. Jarod Ward. And then Monday nights, 7 p.m. Eastern, for now, is when I will be going live. If I need to change it, I'll make sure that I give you plenty of notice. But here we go. Let's answer some questions. So, all right, the first question is about acid reflux in children. So, when we're talking about acid reflux in anybody, but especially kids, what we want to think about is what is the level of stress in their life, because there are two divisions of the nervous system: the sympathetic nervous system and the parasympathetic nervous system. The parasympathetic nervous system is the rest, digest, calming division of the nervous system that tells the body to produce stomach acid, to have healthy digestion. When it's working, digestion works. When it's not working, you're going to get like a lot of basically dysfunction in that upper GI, that stomach, and it's going to fester because everything there, all the food is just kind of beginning to rot, fester, and is there too long because it needs more. Can you guys hear me? Can you let me know in the chat if you can hear me? Someone asked, how do we hear me? Mason, can you hear me? He's on Instagram. Let me keep going. Okay, cool. Yes, people can hear me. Try turning up your volume, J Stenar 10. Try that. Anyways, acid reflux in children. Okay, so when there's a lot of stress in the body will not use that parasympathetic highway to stimulate healthy digestion. And when you don't actually make enough stomach acid, you need a lot of stomach acid to properly break down the food and move it into the small intestine. So if children are having acid reflux, that means the food is up here and it's not opening the door and going to the next phase. And the key to open that door is a healthy level of stomach acid. So even though the stomach acid is low, if it's still acidic. But it has to get high enough to unlock the door. So if it doesn't get high enough, it'll still be acidic, but it stays there, and then it starts splashing up and causing that painful heartburn sensation, even in children. So ways to enhance digestive function. I would also ask, does this child have a history of head injury? The reason why, there are bones here on the side of the head, the temporal bone and the parietal bone, that when they're not in the right spot, they cause the vagus nerve, which is the main nerve that goes to the stomach to tell the stomach to make stomach acid. But when these bones aren't in the right spot, or maybe as a child they had one of those helmets because their head was misshapen, or maybe there was a rough birth, right? And so their cranial bones aren't in the right spot. But when those cranial bones are not in the right spot, those nerves shut off or don't function as well, is basically how I should say it. And so when those bones aren't in the right spot and the communication pathway to the stomach is not as functional, the stomach is not going to make enough stomach acid. So in children, I would look for like a head injury, make sure the cranial bones are in the right spot, make sure the neck is perfectly aligned, because that is the nerve that controls the stomach and tells the stomach to make stomach acid and have healthy digestive function. Another root cause of acid reflux or heartburn or GERD in adults, children, whatever, is a bacterial infection called H. pylori. Really common. H. pylori especially seems to flare up with poultry products, so like egg, chicken, turkey, right? So try, little test here, but if it is H. pylori, your child may be experiencing worsened symptoms after poultry products. So that's a good way to kind of test that at home and see if that's what the root cause of what's going on. In terms of herbals to help basically knock out the H. pylori infection, I like to look at golden seal. It does a really good job, or golden thread. And then also some echinacea, which is a really safe immune stimulating herb to help the immune system clear out the infection naturally. Good. All right, so that's kiddo for acid reflux. I'm so sorry that's happening. Next is remedy for a stomach bug in children. So I would look at andrographis because I love that herb for an immune problem and a stomach bug, and I would try to do it in a liquid. But andrographis is what I go to for my antiviral, flu, etc. Solution for that. I know it's kind of hard to keep food down for kiddos. You could also try, there's a homeopathic called Virucord from Energetics that I really like to use for my kids when they're fighting a viral infection. And that's just like water, like a little bit of water with a little bit of homeopathic and a little bit of alcohol actually in it. And you could put it on the tongue, but that's usually much more tolerable to the average sicko kiddo. So that's why I would try that. Holistic symptoms for relieving TMJ symptoms. If you guys have any questions, you can pop them in the chat too. Holistic solutions for relieving TMJ symptoms. So the TMJ is a joint in your jaw right here. It is one of the most sensitive joints in the entire body. When you look at like nerve endings, and you're going to be like, okay, which joint has the most nerve endings or feedback to the brain, right? You're going to have basically the upper bone in the neck called the atlas, or C1. That's very, very sensitive because we have to know how to move our head around. You're going to have the TMJ, the jaw joint, because you need to know how hard to chew, how much pressure feedback is happening so you can control the strength of your jaw when you're chewing. It's a very fine feedback mechanism. And then the other joint in the body with a lot of nerve endings in terms of proprioception is the ankle joint as well, because you got to kind of balance on the ground. You got to have a lot of fine movement to control your walking, right? So those are the three spots. So whenever you have a problem in any of those joints, but especially the TMJ, you need to make sure that the muscles are relaxed, right? So get someone who knows how to work on the muscles. So whenever I work on a TMJ, I'm working on the masseter muscle, which is right here. I'm working on the temporalis muscle, which is right here. And then I'm going inside the mouth, all the way in the back. And I'm working on what's called the medial and lateral pterygoid muscles. And those are the muscles that also help you chew, help you move your jaw. Okay. So if the jaw is, so you want to work on the structure of the jaw. Okay. I'm not one of those chiropractors who like takes your head and goes on the jaw. I don't think, because it's such a sensitive joint, I don't choose to treat it that way. I do much more gentle work for the jaw because yes, that might be relieving, but I feel like it's increasing the laxity or the flexibility of the jaw, when the jaw really should be stable and strong, right? And do its job, but we don't want it loosey goosey. And so I don't really want to knock it out of its position. So I do a lot more gentle work on the jaw. Another thing to consider, if your jaw hurts, why does it hurt, right? Are you grinding your teeth at night? If you're grinding your teeth at night, you could have an airway issue. You could have a parasitic infection, because when you have a parasitic infection, they release a lot of toxins in the body, and they're really active at night, which causes your nervous system to get really anxious. And when you're anxious, you clench your jaw, right? And so then when you wake up in the morning, you're like, oh my gosh, why is my jaw sore? It's because you were clenching your jaw all night long, and now you finally got to relax, right? But in the morning, but it's still too tight. Okay. So if you are interested in getting rid of parasitic infections, I'm doing a group parasite cleanse the month of October. We're starting October 6th. So it's actually closed, but let me know if you want to join that at some point. I might open it back up again for people, but it's going to be awesome. My next cleanse I'm doing is my all-time favorite. Everyone loves it. My Love Your Liver cleanse. We're doing that in January. We're starting January 12th. So put it on your calendar if you're interested, but it's amazing. I mean, it's my favorite cleanse that I do with people. I mean, the parasite cleanse is great too, but the liver, but it's a little more cookie cutter. So, I mean, it works. It's great. Like, I mean, I had this patient, just to talk about parasites for a second. She was bleeding out of her rear end, right? She's young, she's not old, right? And she had an infection. And so I put her on one of the products in my parasite cleanse, and she had tried lots of things. She tried herbs, she had tried other supplements, she had tried avoiding certain foods. Nothing was getting better. It would kind of get a little better, then it get worse again. Well, I put her on one of the herbal products in my parasite cleanse. That day, the bleeding stopped. It was amazing. So That was really, really cool. So if you are interested in a parasite cleanse, I think mine is awesome. It's just cookie cutter, but which is not a bad thing because it works, right? But then my favorite thing I do is my liver cleanse, because we address the chemistry of the liver, we address the mind, and we address the emotions of the body too, which really helps you break free of like a lot of. It helps make it easier than you would expect it to be. Which is awesome. So, anyways, it's one of my favorite things. People lose weight, people get energy back, people feel great. They're like, a lot of times people, when they're doing the liver cleanse, they're like, oh my gosh, I don't want to quit because I feel so good. I'm afraid I'm going to feel bad again. And so it's really great. But anyways, TMJ, structure. Have someone work on it who knows what they're doing, work on the cranium. Okay. Cranial work is important. And then also think of why you might be grinding your teeth. Is it anxiety? Is it stress? Do you need to modify some things in your lifestyle to help handle that? And is it parasitic? Okay. All right. Another question is about high cholesterol misinformation. Okay, so the way I explain this one, cholesterol. All right. A lot of people, a lot of doctors are trying to put their patients on statins, I think, way too early. And when you get put on a statin, you basically are asking for insulin resistance, which is the root cause of diabetes, and you're asking for your brain to starve. Okay, so when you get put on a statin, it's proven that your risk of diabetes goes up. Okay, so do you want to be diabetic? That's something you have to think about. Do you have a lifestyle that can resist that increased risk, right? Are you already eating minimal carbs, minimal sugars? Is a statin going to help you with that? Most people who need a statin or who are suggested to be put on a statin because their cholesterol is imbalanced, their cholesterol is imbalanced because they're not doing the lifestyle. They're not fixing their lifestyle, right? So if you already have a bad lifestyle that's creating a cholesterol problem, and you get put on a statin, which also increases your risk of diabetes, but you already had a risk of diabetes over here because your lifestyle was already bad. So now you're compounding and making your risk of diabetes even worse than the average person, right? So my vote, as always, is to fix the lifestyle so we can fix your labs, okay? Lifestyle fix equals lab fix, okay? It's not hard. Well, it's hard, but it's not as complicated as you may think, okay? So when you have high cholesterol, okay, what you want to think about is, first of all, whenever there's a fire requires oxygen, okay? But wherever there's oxygen, there is not fire, okay? So it doesn't just mean, just because there's cholesterol there, it does not mean that you're going to have a heart problem or a brain problem, okay? You need 3 ingredients for a cardiovascular event. You need lipid imbalance, which is like cholesterol issues, whatever, not enough good cholesterol, too much bad cholesterol, blah, 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 okay? The jury's still out, in my opinion, on whether there's certain types of good or bad cholesterol. Secondly, you need inflammation. So inflammation is really easily measured by a test called C-reactive protein. So I love that one. Or ESR is another test you could run. So you need lipid imbalance, you need inflammation, and you need glucose or sugar problems, okay, or insulin resistance. So you need to have all 3 of those things before your real risk of a heart attack or a cardiovascular event goes up. So, and what I also tell my patients too is when you're looking at your cholesterol numbers, there's usually you want to take the cholesterol, total cholesterol, and you want to divide it by HDL cholesterol. And you want that ratio, that number that you get, to be below 3.2. If it's below 3.2, awesome. Because if you have the bad cholesterol up here and the low cholesterol is way down here, which is protective, that's not good. But if it's up here and this is also high to match it because the ratio is still good, okay, we're happy. And if it's down here, the ratio is still good, okay, we're happy. What people don't realize is that cholesterol also feeds your brain. And so that's why I think there's a lot of dementia on the rise, because I think the dementia patients have been on statins for way too long, which has been starving their brain, and then their brain doesn't function anymore and they get a dementia and Alzheimer's diagnosis. So I'm talking pretty fast. Sorry, that's just kind of how I am as a person. But basically, cholesterol feeds your brain and it makes your hormones. And so if you are dealing with hormonal problems, or if you're dealing with a lot of inflammation or brain problems, your body will make more cholesterol to try to help out those problems. Okay, so that's what I would say about the high cholesterol misinformation. All right. Here's another question. A best probiotic or supplement for post-antibiotic treatment for a 13-year-old. Well, if your 13-year-old can take pills, I recommend Megaspore. I like Megaspore. It's my favorite probiotic. It's strong, so start with like 1 capsule. And that's what I would do. That was my favorite one. It's great. That's why I don't usually recommend probiotics because, again, we're all about the microbiome imbalance. If you don't want to buy a supplement, I mean, if he can tolerate it, your 13-year-old, I'm assuming it's a he. I don't know, it could be he or she. I would eat kimchi, sauerkraut, kefir, a little bit of kombucha, but not much. Those are my favorite. I try to eat kimchi or sauerkraut every day. So because I want to keep increasing the diversity of my microbiome. I don't want just like one type of bacteria, a ton of them, right? We want to increase the diversity. So, and it works pretty well. So let's see. I'm trying to think if there's any other questions. I don't see any. There is someone asked, what are the guidelines that I need to follow for the parasite cleanse when I start? Those will be sent to you. Okay, so we will make sure that's emailed to you. If you have signed up, you will get the instructions. It will be pretty easy. Okay. Yeah, that's pretty much it. That is actually all my questions I have for today. So this is kind of a pretty quick live. But if anyone has any questions, I will hang out a little bit longer. Thanks for joining, everybody. That was pretty fun. All right, I'll wait like 1 minute and there's no questions. We will end it and I'm going to go eat dinner.